Hello, my name is Adnan Khan, and today I will be presenting research on whether there are racial disparities in the incidence of venous thromboembolism in hospitalized cancer patients with COVID-19. Introduction. Both cancer and COVID-19 have an increased risk of venous thromboembolism. Severe disease needing hospitalization further increases this risk. Studies evaluating the effects of race on the risk of VTE are lacking. African Americans have an increased prevalence of comorbidities that increase risk for the development of VTE. This study was conducted to evaluate racial disparities in the incidence of VTE in the hospitalized subset of COVID-19 patients with cancer. Retrospective chart review of unvaccinated cancer patients hospitalized with COVID-19. Only cancer patients who are on active systemic chemotherapy were included. The primary study outcomes were development of deep venous thrombosis or pulmonary embolism within 30 days of COVID-19 diagnosis. Secondary outcomes included mortality, hospital length of stay, mechanical ventilation, ICU admission, and need for vasopressors. For statistical analysis, mean and standard deviation reported for continuous variables, while proportions were reported for categorical variables. Chi-square test was used for categorical variables, and t-test was used for continuous variables. Multivariable logistic regression was conducted to assess the relationship between race and selected factors. All statistical tests were two-sided with an alpha significance level of 0.05. Results: 73 unique patients were analyzed, 58.9% being male and 41.1% being female. For the race breakdown, 31.5% were Caucasian, 64.4% were African American, 1.4% were Hispanic, and 2.4% were other races. There were 8 DVT-PE patients in the cohort. Of 23 Caucasians, 3 or 13% had VTE. Of 47 African Americans, 5 or 10.6% had VTE. There is no significant difference between the incidence of VTE and race. Multivariable logistic regression did not show a significant relationship between race and VTE, controlling for age, ICU stay, intubation, vasopressor use, ferritin, and IL-6 levels. All patients included in the study were on enoxaparin prophylaxis for VTE. The prevalence of solid tumors appeared to be significantly increased in African American patients as compared to Caucasians. The results are summarized in this table below. We found that the only statistical significance was in the tumor solid and liquid group, with a p-value of 0.013. The only variable associated with DVT-PE was age and the presence of hemoglobinopathy. Incidence of VTE was significantly associated with an increasing graph of PE less than 0.03 and the presence of hemoglobinopathy. Hemoglobinopathy was only seen in African American cancer patients with VTE, N equals 4, and none in Caucasian patients. Results: the incidence of DVT-PE was doubled in the sickle cell group as compared to patients with no sickle cell. Conclusions: contrary to what has been reported in literature, we did not detect racial disparity in the incidence of VTE in hospitalized cancer patients with COVID-19. Prophylactic anticoagulation was likely to have a protective effect. Limitation: the main limitation of our study is a small sample size. For future work, racial disparity was observed in African American cancer patients with hemoglobinopathy with increased VTE risk despite prophylactic anticoagulation. This warrants further evaluation. The role of more rigorous VTE prophylaxis in the subset should be prospectively evaluated. Thanks so much.